Hello friends, welcome to Local Mart Doctors. Friends, today we came to touch therapy, Green Park. तो फ्रेंड्स अभी जैसे हमने डॉक्टर सैफ से बात की थी, शी इज़ सिस्टर ऑफ डॉक्टर सैफ, शी इज़ डॉक्टर सुबुल, शी इज़ ऑल्सो फिजियोथेरेपिस्ट फ्रेंड्स. सो आओ आपको एक बार इंट्रोड्यूस करते हैं डॉक्टर सुबुल से. हु इज़ डॉक्टर लाइक सुबुल इज़ ऑल अबाउट एंड हर जर्नी एज ए फिजियोथेरेपिस्ट, कितना एक्सपीरियंस हो गया उनको, और कुछ फ्रूटफुल इनके वैल्यूबल फीडबैक्स लेते हैं कुछ डिफरेंट टॉपिक्स पे. तो लेट्स स्टार्ट विद डॉक्टर सुबुल फ्रेंड्स.
So, hi, I'm Sumbul Naqvi. I'm a physiotherapist. I did my 4.5-year degree from Institute of Rehabilitation Medicine and Allied Sciences, which was associated with IP University, Delhi. After that, I went to New Zealand for doing sports and exercise science. So, after working for a year in a government hospital doing my internship, I actually got a little depressing, all the sick cases. So, I thought of expanding my horizons and be able to work with a more fitter population. So I learned about sports and exercise science for a year in New Zealand, and then I worked there for 2 years. Then I came back and I got married, and meanwhile my brother had started this clinic of touch therapy, and he was associated majorly with the cricket teams and all. So he used to travel around, and I used to be more stationed here looking after the patients and the rest of the sportsmen, which he wasn't traveling with. So yeah, so it's been more than 11 years since I've been working in this field in India. Before that, for 2 years, I was working in New Zealand. I worked there as a fitness consultant, and I was advising people for nutrition and diet and helping them keep fit and reduce weight. Then when I came back, I joined back as a physio with all my experiences of seeing other sort of population and all that plethora of knowledge I added. But still, for us, it wasn't really only work, it was a bit of a passion. So if we got stuck with some issues which we were thinking were not getting resolved so well as we wanted to, we kept on learning new things. So that quest for knowledge led us to different areas in the world, and led us to know more such therapies which were to do with hands. And so today we are equipped with a lot more skills than what we started with. So I do lymph drainage, which is lymph is a fluid in the body which if you take out red blood cells, whatever remains is lymph. So I work on that, help people elevate the pain, and so many other conditions like post-cancer survivors. Then we worked with visceral manipulation, where we can mobilize the organs. We got to know later on that sometimes the back pain can also be a resultant of something happening wrong in the front, as in something like an organ giving or radiating the pain behind at the disc. So we learned how to manipulate that and how sort of ease all that and make it all come in tandem so that it affects the back less and less and help resolve the problem sort of permanently. And so many, and then one thing, there's this structural integration, which is based on Dr. Ederol's way of working on fascia manipulation. So we've learned that. It is like a 10 series program. We learned it for a period of 3 years. So many other things I learned. And now I'm very glad I'm able to help people. So the conditions which we were able to help people in sort of a month's time, now we can give them relief in less than 10 sessions. So that has been the benefit of constantly learning and upgrading ourselves. And I strongly believe as a clinician, we cannot afford to shelf our books. We have to constantly update ourselves so that we should be abreast with whatever is happening around the globe. Whichever new scientist or practitioners bringing something new, we should be quick in hoarding that and be able to apply it to everybody, So the quest is still on. We are still learning. Because of the corona and the lockdown, we couldn't travel as much, but we learned a few online things. So there's a very interesting one I learned recently, which is called integrative eye movement therapy, where we help people remove their negative memories from the brain just by making them help move their eyeballs. So the journey is still on, it's still not over. And every day like my brother and myself, we compete with ourselves to be a better version of ourselves every day. That's how my journey is about as a physiotherapist.